Good afternoon, my Facebook friends. Very good afternoon. Myself, Dr. Harsh Patel. I'm a consultant pediatric neurology at Jairus Hospitals, and today I'm going to talk about childhood epilepsy. I will discuss with the basic and essential facts about the topic, and I will also discuss what are the prevailing myths in the society and in the parents who are suffering or children are suffering from the epilepsy. So before going to core subject of our talk, let me introduce what we mean by pediatric neurology, because it's a very upcoming branch and many of the society people who are not aware of especially about this branch. So pediatric neurology is a specialized branch which is dealing with the only neurological disorders of the children from birth to up to 18 years of age. And a pediatric neurologist is a doctor who is specialized at training not only in the neurological disorders but also having a very core insight of the pediatrics. So that make them a very specialized and very efficient in looking into the and also taking care of these children who are suffering from the neurological disorders. So make sure that whenever your friends or even in your society or in your family, if any children have any neurological problem, always try to consult a properly trained pediatric neurologist. So now let's say when we are talking about the childhood epilepsy, first we have to understand what we mean by epilepsy, because epilepsy is a condition of brain in which patients or that child is a very liable to have a recurrent of seizures. So whenever any children or any person have a two or more than two seizures, then we label as an epilepsy. Now people, it's a very usual or very typical thought, why it happened? First of all, we have to understand how the brain works. Before we are going to, in the detail or in the very peculiarity of how the brain works, let's take a very simple example. If you are talking about the brick, if you are talking about the wall is made by the bricks. If I take one by one every brick, then the wall will be collapsed. In the same way, similar fashion, brain is made of neurons, which is a basic unit of the brain. So there is a millions of neurons which constitutes the brain. If I remove one by one, then the brain will disappear. So what happened exactly when these neurons, a group of neurons, when they become autonomous, they become overexcited, and they are not uncontrollable fashion. That lead to certain physical forms or certain clinical manifestation which we called as a epilepsy. And at that time, usually person or the child get unconscious. He or she may have a jerking of the body, which may involve one part of body or may involve the other parts of the body also. They may have a facial twitching also. Their eyes may go up down, or they may have a one side deviation of the face or eyes. And this kind of clinical features we usually realize as a seizure. And when a person has a two or more than seizure, then we call as that person is suffering from the epilepsy. So this is how the basic concept of the epilepsy. Now what happened, that epilepsy, that particular seizure event may go for a few seconds also, sometimes few minutes also, and in a very bad scenario, they may even continue for hours or even for days also. And that scenario is very critical and very serious for the patient. At that time, it can be even life-threatening also. So this kind of a thing we have to realize very early, and hence whenever you find any seizing patient, there is always better to call immediate or bring that patient to a nearby hospital or nearby medical facility. We will also discuss in our talk how to control seizure at whenever we see them in our later portion of our talk. So one may even think that what should we do if a person is suffering from the epilepsy, then what are the tests are required, and how we can understand what exactly going wrong in the brain which leads to the epilepsy. So usually whenever the patients or the children are coming to us with a complaint of the seizures or epilepsy, then we require a very detailed description of that event, exactly what child was doing at that time of event, exactly what happened during that event, and what is the immediately post after that event. So that word description is very crucial for us to understand exactly what is this child having a seizure or not, and if this having a seizure, then which kind of a seizure and what we can do for it. So you have many of person have gone through this thing. Many of person have also heard about certain tests like EEG and MRI. And these tests are routinely offered to the patients with the epilepsy. Each and every test has some of the basics, some of the, we want to understand what exactly going wrong in the brain, and hence we suggest this kind of a test. So, for example, if we talk about the EEG, EEG is basically, it's a kind of a electrical graph of brain. You have heard about the ECG, which we usually see for the heart conditions, and we understand how the heart electrical activity of the heart is going on. It's a similar fashion. EEG tells us how the electrical pattern or how the electrical activity going inside the brain. And by certain disturbances of that electrical activity, we get to understand exactly what happening and which area of brain is mainly responsible for the seizures of the brain. There are certain disorders which are especially seen in the children who are suffering, we call as epileptic encephalopathy, in which their electrical rhythm is completely disturbed. They completely go haywire, and in this kind of a children, because of this kind of seizures and this kind of electrical rhythm, there is very difficulty to learn and also to develop according to their age. So this is a very dreadful conditions, and it has to be identified as early as possible. And there are certain medications and there are certain set of we can say therapies available for this kind of a children, and we can help from grow out of this kind of conditions. And MRI brain is usually we see how the brain looks like. So it's just kind of a photograph of a person. So we understand how the person is looking like. So thus the MRI is doing exactly the same thing. How is the brain is looking like structurally? Is there any there is an area of the brain which are not usually looking like a normal? Is there then is evidence of any old insult? Usually in pediatric age group we commonly see there is a perinatal insult. So while during the birth process or even immediately after the birth, the children have a difficulty initiation of their breathing, and that time due to the deprivation of the oxygen can lead to a brain damage, and hence that damage have a very long-term sequelae that also affect their development also, and even that can cause a very condition which their seizures are very sometimes reflected to the medications also. So this kind of things we can identify over the MRI, and we can provide whatever the remedies available for that patient or for that children according to this kind of a test. As far as the epilepsy is concerned, if I take a 10% of suffering from the epilepsy, the 6 will be the children. So the children have this much amount of the burden of the epilepsy. And epilepsy is one of the most common neurological disorder which is prevailing in the children. So as a layman or even as a parent, we must know what are the symptoms and how we should identify this kind of a condition. And whenever we realize, okay, my child or my family, any child is suffering from the epilepsy, it is very urgently or in an optimum time we should reach to a facility where we can consult a pediatric neurologist. So now moving to the another part, as is the clinical symptoms as I described earlier. Even as the child is growing, as we know that from the birth to the early adolescent and even up to 18 years of age, the child is passing from a very peculiar phases of the brain development. And as per the development of the brain, her clinical symptoms and the signs are also changing. So in the newly born child, they just turn blue, they just have a cycling like movement, or they just have a lip smacking. And then we understand, okay, he's having the seizures. So it sometimes is very difficult even for the pediatrician also to identify this kind of a event as a seizures. So it required a very meticulous examinations, and also very we should be very thorough with this kind of particular problems. Then only a person can deal with the this particular epilepsy. So now moving on the further, once we have understood this kind of symptoms, this kind of set of investigation, now what are the treatment options we have available, or what treatment we can offer to our children or the patients when they are suffering from epilepsy. So there are many medications available in the market that which what we can help to suppress the electrical activity which is responsible for the seizures. So these medications, a group of this medication is known as anti-seizure drugs or even anti-epileptic drugs. So there are very there is a significant number of the medications available. But before deciding which medications to start, it depends upon the child age group, child weight, and also the which kind of a seizures he is suffering from. So only after deciding that only we can decide, okay, he's required this medication, or this medication won't work, or this medication will work. And always with the when we write a medication, there is always a set of side effects is also there. So we have to make sure, we have to make understand the parents that these are the side effects of this medication, and whenever they feel that children have this kind of a thing, then they should report immediately. Because in our scenario, when we are, if you are looking at the pediatricians or any pediatric subspecialty, the children are not able to give until and unless they are beyond the grown-up age that they can narrate the symptoms. So we always have to rely on the parents for the critical informations, or the nearby, or the whatever the event has been seen by the whatever the relatives. So until and unless we don't get a proper or the peculiar information, it is always difficult to decide the next step in the management. So sometimes even after giving the medications, even after choosing the appropriate medication, sometimes happen that seizures are may not, they still continue to evolve. In this kind of the scenario, when we to use a two drug, which is anti-seizure medications, and they are working, they are appropriate for that kind of a problem which a child is suffering. Even if we are not getting a proper response, then we have to decide, okay, what are the next treatment steps. So in this scenario, it required a very specialized center, which is sometimes also known as a comprehensive epilepsy centers. And this kind of a centers, we usually do a very long-term EEG recording. We do a very specialized test for the brain, and we understand how the brain is working. Exactly what conditions or which are the area which has the maximum electrical abnormality and which is responsible ultimately the seizures. And this information is very crucial and very important for that subset of children who are not able to control their epilepsy even with 2 or 3 medications. And this is very few places available in India now. Each and every day it is upcoming, and we are happy to announce that we are one of that place that we can offer this kind of a higher investigations and also very specialized techniques to look into the brain exactly which area is responsible for this kind of a problem. Now moving on another phase, that if many of the parents, they just get shocked, and this is very usual when in front of your eyes if the child is seizing, then they usually they try to put something in their mouth, they try to sprinkle water or something else in their mouth, they try to smell something. These are the very typical scenarios we usually see in day-to-day our practice. I think all this should not be happen. We should not do any of this kind of activity when we see any child or any person is seizing. There are certain do's and there are certain recommendations we should be followed. So whenever you see that your child is seizing, you have to just make sure that he should be lie down in a lateral position. Either it could be right or it could be the left. That's why, because the most important thing is that whenever you have a seizures, you are unconscious. That person is not in his senses. So he's not able to swallow, or even he may vomit also. That because of unconsciousness, he can aspirate into this vomiters, or this substance can aspirate into his or lungs, and then can damage also that lung. So preventing this thing, we want him to vomit whatever he can outside of his body. So that's why the lateral position is very essential. And whenever you have a seizures, now there are the very beautiful medications available, which is known as the intranasal spray. When you spray inside the nose, and the seizures are just subsided. So I'll just demonstrate to you. These are the kind of a spray which is available, and you have to just shake before use, and then you have to just spray into the nostrils. And according to the age, your doctor can prescribe, or your pediatric neurologist can prescribe which amount of the spray you should be using inside whenever your child or whenever your nearby person having the seizures, and they are very easy to carry medicines, and as soon as you spray the amount of which is required according to the his or her weight or her age, the seizures are usually 90% of the time the seizures are usually subsides, and safely you can bring in that person to the nearby medical facility. So whenever the patient having the seizures, the time is the brain. So as soon as you control the seizures, you can save the brain. So whenever the seizures, the studies have shown that when it lasts more than 15 or 20 minutes, there is a ninefold increase in the chance of damaging the brain. So as soon as we just suppress this activity, just we can make sure that seizures are not lasted for a few more than few minutes. We are doing a great job. We are just not only preventing the seizures on further propagating, but we are also saving the brain. So these are the simple, easy to carry medication. Each and every parent whose children are suffering from the epilepsy, they must have this medication in their pocket or in their with them whenever they are going out, or even in their home when they are with their kids. Another very beautiful thing we can do for our children who are suffering from the epilepsy, we can make an identity card. We can write which kind of diagnosis is suggested by the pediatric neurologist for him. We can also write which medication he is taking, and we can also write in that card which number of puffs is required if you found him unconsciousness or seizing. This is a very useful card. We have conducted one project for this, and this is showing a very good results. So because any person is not knowing when he can or she can have a seizures, so if they can carry this card with them, even in the when they found unconsciousness or passerby also, they can read this card and they can help in this kind of a situations. And it's not only the life saving, it's also very helpful for a important of the improving the quality of life of this kind of patients, that give them freedom to move freely in the society and whatever the activity they want to do. Sometimes parents also usually ask that what kind of sports or what kind of activity we can allow in our children when they are suffering from the epilepsy. Per se, epilepsy doesn't disbar or disqualify any child from any kind of a sports. But usually we say that precautiously you should avoid a very high contact gaming sports, kind of a rugby or kind of a football, which have a very high rate of concussion injury, and already you have a brain problem and it can exacerbate that problem. Another thing we can also would like to address the parents also would I like to tell that whenever your child is swimming, you make sure that his guide or there is a swimmer expert is always available nearby that child, because if you are in water and if you have a seizures, the first thing you will lose your consciousness and you don't know, and once you are in the water you don't able to breathe, and that thing is leads to a highly injurious and very damage to the very hazardous to the brain. So this thing we should be prevent. So in the swimming we always want that parent should be already convey the message that one person should be always there whenever your kid is in a pool or in the is swimming. Sometimes when it's a kind of a even after getting medications and even after starting medication, the parents feel that now my child is seizure free, is doing absolutely well, and there are 6 months has been gone. Now what should we do? Usually you have heard that whenever we prescribe the medication, we always ask this medication for a certain period, and usually once we label a child has epilepsy, the duration of the medication should be at least minimum 3.5 years. So why this long duration is required? Because with drugs we want to control the abnormal electrical activity of their brain, and by biologically the brain is created in a such a way that we require a longer duration of exposure of certain stimulus, then only brain can get trained. That's why our education has a 1/4 of our lifespan. So if we invest 20-25 years in the education, and then only we can learn or we can able to do our professional job. And the same way, even for this kind of abnormal activity, we want to suppress as long as possible. And if you can do in a first straight away, when you started the first time in the anti-epileptic drug, and you can continue the drug for the prescribed duration, and you can suppress the electrical activity, lifelong your chances of having a recurrence of seizures will be very minimized. Sometimes we see that patient feel that parents feel the child is doing absolutely fine, and after a few months they just stop the medications, and child will also remain seizure free for a few months, but again they come with the seizures. At this time, while there were the previous medications, we have not only increased that dose, we also have to increase the duration. So overall, if we see that not only increase the economic burden, but that also increases the exposure risk of the side effects to that person also. So we have a damage on the both the side. So it is always preferable whenever you are starting the first anti-epileptic medication, you just complete the whatever the prescribed course which is suggested by your neurologist or your physician. Now moving to another thing that I would like to discuss in this talk, that sometimes parents feel that okay, my child has a seizures, now we have given the medication whatever the doctor has suggested, now what after now he's grown up, so what will happen when he's grown up? Is it having the same thing? Is it having continued the same kind of seizures even when the adult? Let me tell you, if we can continue the medication on the prescribed durations on appropriate dose, there is a very minimal chances, or we can say that we reduce the risk in such a basic level, it is as good as a normal person. So we cannot, we should not be afraid that my child, when you get adult age group, he has a seizures or something like that. But whenever you find your child having a diagnosis of epilepsy, you just continue the prescribed course, so we can help the child to live the symptom-free life as long as possible. Okay, thank you so much. And I'm getting some questions, so I'll just discuss these questions and how we can, help this. So the first question is I'm getting is, will my child become poor in academics if he or she is epilepsy? This is a very important question, and this is a very important query, from the parents, because let me tell you, there are certain epilepsies which we call as epileptic encephalopathy, in which brain activity is so hazardous or so bizarre that can cause a problem in memory, in retaining the information. That is right. But if we talk about the proportion of this epilepsy, is just 2 to 3% out of the total epilepsy which are available in the world. So this is very minuscule portion. Rather 95 to 97% who are suffering for epilepsy, if they are properly diagnosed and properly managed, they carry as good as normal life as we do. There is no adverse event on their academics or their memory or their cognitive functions. Another question is, what are the signs of the worsening epilepsy? So yes, this is a very good question. Once, as I discussed earlier also, once you have a diagnosed epilepsy, you are started on the medication, and even after the medication, your kid is not responding as expected by your neurologist or your pediatrician. So there is an increased number of the frequency, or there is a change in nature of seizures, or sometimes it also happens that there are certain other symptoms which appears, that your kid is become very much hyperactive, your kid is become less attentive, is more in such a way that is less obedient. So you also feel that he is not as good as in academics as before. So these are also other signs which are ongoing epileptiform activity, which are not able to suppress with the medication, or we have choose the wrong medication for the given epilepsy. So these are the certain signs of the epilepsy which should be understand, and we have to act upon that accordingly. Can a child go to school if she has epilepsy? Absolutely. If the child has epilepsy, there is no contraindication that he should not go to school. Rather, I have said earlier also, the 95% of the children with epilepsy, if they are properly diagnosed and properly given the medication, they can continue their schooling as normal as other kids can do. Okay. So the fourth one is, if I forget a dose to give my child, and will it affect, and should I double the dose in the next time? I think, yeah, this is a very commonly occur scenario whenever we prescribe the medication, because it's a long-term medication. 2.5 to 3 years is a really long time, and this usually happen. We may miss some doses, and then what should we do? There is no need to increase or double the dose whenever you have the next dose time. So just if you forget the dose, okay, whenever your next dose is coming, you just give the whatever you have been prescribed. But make sure that you can put the alarms in your mobile phone, or you can have there are certain apps is also available which can put your reminder to give the dose. So you can use this kind of a technology, and you minimize the whatever you are missing on the giving the dose to your kid. How long medication should be given? As I discussed earlier, minimum we want that at least 2.5 to 3 years the medication should be given. But in a certain scenarios, when we find that whatever the reason behind the epilepsy is not not so simple, or something complex, or very not easily to controllable, in that kind of scenario we may increase the duration of the drugs, and sometimes even up to 5 years or even more than that also. Can epilepsy get cured? I think this is a very important thing, and each and every patient, when their parents are coming to us, they always in the hindsight is that there is a question: can epilepsy get cured? Rather than I would like to put in other words. Epilepsy usually, majority of the epilepsy in the childhood epilepsy, they get children are outgrow from it. So whenever they passes that certain age, they have a very minimal risk of having a recurrence of their seizures. So if they properly identified, properly given medications for appropriate duration, majority of the children, yes, they do outgrow of the epilepsy, and they can lead a normal life the way we are living. Okay, so thank you so much for being with me. It's a really enjoyable time to talk with you, to answer your queries, and it's a really a good platform to share my experience till date with the children of epilepsy and whatever I have learned about them. And I hope this information is useful to you, and that can make your children's life with children with suffering from the epilepsy, the life of the children make more comfortable, more easier, and more confidently you can go forward in that direction. Thank you so much.